Do you often feel stiffness or discomfort in your back, especially in the morning or after sitting for a long time? For many seniors, back pain is a daily challenge that makes it harder to enjoy life. But here's the good news. Movement is medicine. Gentle, safe stretches and exercises can reduce stiffness, improve flexibility, and strengthen the muscles that protect your spine. You don't need expensive equipment or a gym membership. Just a few minutes each day can make a big difference. In today's video, we'll explore simple, senior-friendly stretches and exercises that are both safe and effective for easing back pain. These movements are recommended by physical therapists and supported by research from trusted institutions such as the Mayo Clinic and the American College of Sports Medicine. Before we begin, please take a moment to like this video, subscribe to our channel, and hit the notification bell so you won't miss more health tips designed to keep you active and independent as you age. Part 1. Why do gentle stretches help so much? According to the National Institute on Aging, seniors who engage in light stretching and mobility exercises at least 3 times per week report significantly less pain and greater independence in daily activities. The reason is simple. When you stop moving, muscles shorten, joints stiffen, and circulation slows down. This creates a cycle of pain and immobility. But when you move, even gently, blood flow improves, oxygen reaches your muscles, and your spine gets the support it needs. Let's start with the first safe stretch, the knee-to-chest stretch. This gentle movement helps relax the lower back muscles and relieve tension in the spine. It is one of the simplest yet most effective stretches you can do from the comfort of your bed or floor. Lie on your back with your knees bent and your feet flat on the floor. If lying flat is uncomfortable, place a pillow under your head for support. Slowly bring one knee up toward your chest, keeping the other foot firmly on the ground. Use your hands to gently pull the knee closer. Hold the stretch for 20 to 30 seconds while breathing deeply and evenly. Focus on relaxing your lower back with each breath. Switch legs and repeat. Do 2 to 3 repetitions on each side. For a deeper stretch, supporting the spine. Weak core muscles are one of the main reasons seniors experience chronic back pain, so this movement is especially important. Lie on your back with your knees bent and feet flat on the floor. Keep your arms relaxed by your sides. Flatten your lower back against the floor by tightening your stomach muscles and gently tilting your pelvis upward. Imagine you are pressing your belly button into the floor. Hold this position for 5 seconds while breathing slowly. Then relax. Repeat 10 to 15 times, resting briefly between each repetition. Pelvic tilts are subtle, but they teach your body how to stabilize the spine and reduce pressure on the lower back. A 2020 study from the European Spine Journal confirmed that pelvic stabilization exercises like this can significantly improve function and reduce pain in people with lumbar discomfort. One of the best things about pelvic tilts is that they are safe and accessible. You can do them on the floor, on a firm mattress, or even standing against a wall if lying down is difficult. With time, this exercise trains your core to engage naturally during daily activities like walking, bending, or standing up from a chair. Together, the knee-to-chest stretch and pelvic tilts form a powerful foundation. They relax tense muscles, strengthen core support, and prepare your body for more movement. Even doing these 2 exercises daily can help reduce pain and restore confidence in your mobility. And remember, consistency matters more than intensity. Doing a little every day is far better than doing a lot once in a while. Part 8. We have already learned 2 powerful foundation movements, the knee-to-chest stretch and pelvic tilts. Together, they reduce stiffness and strengthen your core. Now, let's add 2 more gentle but highly effective stretches that improve flexibility, release tension, and restore mobility to the spine. The cat-cow stretch and the child's pose. The third exercise is the cat-cow stretch. This movement comes from yoga, but is widely recommended by physical therapists because it improves spinal mobility in a very safe and controlled way. It alternates between arching and rounding the back, helping to lubricate the joints and gently massage the muscles that run along the spine. Here's how to do it. Begin on your hands and knees in a comfortable position, with your wrists directly under your shoulders and your knees under your hips. Place a folded towel or soft mat under your knees for comfort. As you inhale, gently lift your head and tailbone toward the ceiling, letting your belly sink toward the floor. This is the cow position. As you exhale, slowly tuck your chin to your chest, round your back upward like a stretching cat, and draw your belly button toward your spine. This is the cat position. Continue moving smoothly between cat and cow, matching the rhythm of your breath. Aim for 8 to 10 repetitions. This simple motion increases flexibility in the spine, reduces stiffness, and improves circulation to the back muscles. A 2020 study in the Journal of Bodywork and Movement Therapies found that gentle spinal mobilization exercises like cat-cow significantly decreased pain intensity in older adults with chronic low back pain. Many seniors also say that this exercise gives them an immediate sense of relief, almost like unlocking a tight spine. If getting down on the floor is difficult, you can do a modified version by placing your hands on a sturdy table or countertop while standing, and moving your back in the same arch and round pattern. The benefits remain the same, and you don't have to worry about straining your knees. The fourth exercise is the child's pose. This is another yoga-inspired stretch that gently lengthens the spine and relaxes the entire back. It is especially effective for promote relaxation and can lower perceived pain levels. If kneeling is difficult due to knee pain, you can modify child's pose by sitting in a chair and bending forward to rest your chest on your thighs, with your arms hanging loosely toward the floor. This seated version still stretches the lower back safely and comfortably. Together, the cat-cow stretch and child's pose create a powerful pair. One mobilizes the spine through gentle movement, and the other allows deep release and relaxation. Practiced regularly, these exercises help seniors maintain flexibility, reduce daily stiffness, and improve overall spinal health. The key, once again, is consistency. Even just 5 minutes of cat-cow and child's pose in the morning or evening can transform how your back feels throughout the day. These are not about pushing limits. They are about restoring comfort and keeping your spine healthy for years to come. Part 3. We have already covered 4 powerful movements: the knee-to-chest stretch, pelvic tilts, the cat-cow stretch, and the child's pose. Together, these help release tension, improve flexibility, and stabilize your core. Now let's add the final 2 exercises that complete this gentle back care routine: the bridge exercise and the seated spinal twist. The 5th exercise is the bridge. This simple but effective movement strengthens the glutes, hamstrings, and lower back, while also engaging the core. Why does this matter? Because strong gluteal muscles support the pelvis and reduce strain on the spine. Many seniors experience back pain simply because these muscles have weakened over time from too much sitting. The bridge is one of the safest ways to restore strength. Here's how to do it. Lie on your back with your knees bent and feet flat on the floor, hip width apart. Keep your arms relaxed by your sides. Press your heels into the ground. Tighten your stomach and glutes, and slowly lift your hips toward the ceiling until your body forms a straight line from shoulders to knees. Hold the position for 5 to 10 seconds, breathing steadily. Slowly lower your hips back down to the floor. Repeat 8 to 12 times, resting briefly between repetitions. According to a 2021 study in the Journal of Back and Musculoskeletal Rehabilitation, strengthening exercises like the bridge significantly reduced pain intensity and improved mobility in older adults with chronic lower back discomfort. The key is to move slowly and focus on muscle control, not speed. If lifting too high feels uncomfortable, even a small lift is still beneficial. Over time, this exercise builds stability and resilience in the spine. Now let's move to the sixth exercise, the seated spinal twist. This is a gentle, seated stretch that improves spinal rotation and helps relieve stiffness in the lower back. It is especially useful for seniors who spend a lot of time sitting because it counteracts the rigidity that builds up in the spine. Here's how to do it. Sit on a sturdy chair with your feet flat on the ground. Sit tall with your back straight. Place your right hand on the outside of your left thigh and your left hand on the armrest or back of the chair. Slowly twist your upper body to the left, keeping your hips facing forward. Arms. Even this small motion helps maintain mobility and reduce stiffness. With these two final exercises, the bridge and the seated spinal twist, we now have a complete routine of 6 safe stretches and exercises for seniors with back pain. Performed together, they target flexibility, strength, stability, and relaxation. Best of all, they require no equipment and can be done in just 10 to 15 minutes per day. Let's quickly review all 6 exercises. The knee to chest stretch, for relaxing the lower back. Pelvic tilts, for strengthening the core and stabilizing the spine. The cat-cow stretch, for improving spinal mobility. The child's pose, for deep relaxation and lengthening the spine. The bridge, for strengthening the glutes and reducing strain on the back. The seated spinal twist, for improving rotation and easing stiffness. Individually, each of these movements provides benefits. Together, they form a well-rounded program that can help reduce chronic back pain, improve posture, and restore confidence in movement. The key is not to rush or push beyond your comfort zone. Gentle, consistent practice builds strength and flexibility gradually, without risk of injury. Before we close, here is one important reminder. If you ever experience sharp pain, dizziness, or unusual discomfort while exercising, stop immediately and consult your doctor. These exercises are safe for most seniors, but every body is different, and it is always wise to listen to your own limits. Thank you so much for watching this video. If you found this information helpful, please give it a thumbs up, subscribe to our channel, and share it with others who may benefit. Your support helps us continue to bring science-backed health tips to seniors and families around the world. And always remember, small daily movements are the building blocks of lifelong strength, mobility, and a pain-free back.